So you just met with the orthodontist and they said you're ready for braces. So what's the next step? So I think that's probably what comes to mind when people think about impressions and orthodontic records. A very difficult mold taken of your teeth. It's difficult to breathe and all that, but really if you leave the impressions to the professionals who've been doing this and have been trained to do this, it's actually not that bad of a procedure. And actually for most patients, it's actually pretty easy. Hello and welcome again to Braces Guide. My name is Dr. Dave. I'm a board certified orthodontist and we'll be talking about orthodontic records today. So usually you've seen your orthodontist, you get the initial exam and they go over all these details with you about some possible treatment alternatives. Really what the orthodontist needs is a little bit more information to make that final treatment plan and make those final decisions about what is the best plan for you. So what are the orthodontic records? So most orthodontists will take some x-rays, they'll take some photographs, and they'll also take a model or an impression or a scan of the teeth to get a 3D model of the teeth and of the bite. The two x-rays, the first x-ray is usually a panoramic x-ray, and just as it sounds, it takes a panoramic view of the upper teeth and of the lower teeth, so you're getting a really good overview of the upper and lower jaw. The cephalometric x-ray is taken from the side, and that gives us a really good view of your upper and lower jaw position, gives us some information about how a patient might be growing if they're a younger patient, and it also gives us an idea about the tooth position in the upper and lower jaw as well. Photographs are also taken. We take both extraoral and intraoral photographs, and those pictures give us a good view of the soft tissue so we can see lip position, with and without a smile, soft tissue from the side. All of these things sometimes come into play during braces because those things can sometimes be affected by the braces or the treatment plan. And then of course the impressions for the models. So either an impression is taken where the material is put in your mouth, sits there for about 30 seconds to a minute, it's taken out, poured up in plaster, and then you can make a plaster model from that. Or some orthodontists now are using the digital scanners, which gives us that three-dimensional view by just using a camera, like a little wand that goes over the surfaces of your teeth. And then that gives us that three-dimensional model that we're looking for. So why do we need the records? The orthodontist will be looking at the records, specifically, for example, the panoramic x-ray. That overall view gives us a really good view of the teeth, so we can look at the roots of the teeth, make sure that they're of good and normal quality and length and good supportive teeth. You can also see if there's any pathology, either around the roots of the teeth or in the jawbone and other areas. Sometimes there's missing teeth or extra teeth. Now this is really important because if you start to move teeth around and there's extra teeth in the way, you can actually cause a lot of damage. And so it's extremely important, extremely critical to get a good overview of what's going on underneath before you start moving teeth. It's one of the reasons why I really advise against do-it-yourself type of orthodontic treatment. Because if you're trying to do something at home on your own and you don't have a good full diagnostic view of what's going on underneath, if you have extra teeth and you're starting to move teeth around, you could actually cause a lot of damage to your teeth. On the cephalometric x-ray, so specific things that we're looking for here, we're looking for the upper and lower jaw relationship. So in some cases, one jaw might be ahead of the other. So in a situation where you have a class 2 malocclusion, where the lower teeth, lower jaw are behind the upper teeth and the upper jaw, sometimes that bite is because of how the teeth are positioned, and sometimes there's a skeletal component to that. And with the x-ray, you're able to really get a good view of how much is due to how the teeth are positioned and how much is due to how the jaw is positioned. So the cephalometric x-ray can be really helpful to see where the patient is right now, but it also gives us that baseline for future comparisons. So if there's some changes with how the patient is growing and how the jaws are changing, it gives us a real clear idea about what's happening. So the models of the teeth give us a really good view of the teeth. Of course, we can see the bite position, we can see how much crowding there is. The models are very handy for the orthodontist. They can be moved around, they can be looked at from all different sides. We can see that very clearly. The other advantage with the models is that we can measure how much crowding there is. We can measure the sizes of the teeth. We can look at how wide the upper jaw is versus the lower, for example. So there's all kinds of measurements that can be made and that the orthodontist will use in the treatment planning process. Once the orthodontist pulls all that information together, they can develop really the best, most customized plan for each patient. Looking at all those different records really gives the orthodontist the best tools to make that final diagnosis and then the best treatment plan, customized treatment plan or customized treatment plan options for the patient. And all of that will be described to you in a future appointment. So the orthodontist will go over all of the things that they see in these x-rays and the models and the photos. They'll talk about what things we want to try to improve on and things that we need to be aware of, some risks, complications, limitations, all of these things that are very important. And they'll also discuss any pathology or any other findings that they found on the x-ray with you at that visit. I hope this video has been helpful for you as you go along your orthodontic braces treatment process. If you liked the video, give us a thumbs up. Make some comments down below if you have some ideas about future videos or if you have some questions for me. Also, go ahead and hit subscribe if you'd like to be notified of future videos. Thanks again, and thanks for watching.